Happy Thursday, everybody. It's Dr. Adam Smith here at Ultimate Bariatrics. Quite a week we have. We're 1 week away from the election, so hopefully everyone will go out and exercise their right and vote for the candidate of your choice. Very important. So that we're very blessed and fortunate to have the right to exercise our vote every 4 years and choose who's going to lead our country. I'm not going to put my opinion in there. If you want my personal opinion, you'll have to just wait for that. But along those lines, social media is like, here we are, Facebook Live. We use social media for a lot of different purposes here at Ultimate Bariatrics. We use it. We have a public Facebook page that's through our website that is for patient acquisition and to get people to know us, get people to know the doctors, get people to know what we do, why we do it, how we do it, all those things. But we also have a private Facebook page that really is restricted to our post-operative patients. And we're not being selfish or mean or rude or anything, but we want you as our patient to have a page that is just for you. And really even more micro-focused on that, we're happy to have our seasoned, experienced patients on there to help along the newbies, but it really is for the young people that are just entering this process, and I don't mean young in chronological age, I mean young in how far along they are in the process of surgery, to have support, because weight loss surgery is hard. To admit that you've done every diet, joined every gym, done everything you can possibly do to get the weight off and keep it off, and it's not working, and that I need help to change my lifestyle and to get healthy. That is a very hard thing to face. Walking in the door for that first appointment, or nowadays doing a FaceTime or a Google Duo appointment, and sitting face to face with a doctor and confronting the reality that you need help is very hard. But that's just the beginning. The process itself is very hard, because we're having to deal with an insurance company, we're having to deal with different prep programs, we're having to deal with different clearances based on your medical history, whether that's a cardiac clearance or a pulmonary clearance or a renal clearance or a nephro, any kind of clearance that you need. And then, are you required to have a behavioral or a psychological evaluation? Yes or no? And I don't want to piss off all the psychologists and sociologists out there, but so far, outside of disorders of thought, I haven't found a great test that predicts who's going to lose more weight than someone else when they have weight loss surgery. That's not the purpose of our psychological examination. Our psychological examination either meets a requirement for insurance, or it is there to provide you a safety net should you need additional support after surgery, okay? Because if you haven't seen someone pre-op and then you're having struggles in the post-operative period and we say you need to go see our psychologist, sometimes people think they're getting sent to the principal's office. Well, we don't want you to feel that way. We don't want you to feel like you're being sent to the principal's office. We want you to feel like you're seeing a friend that you already know. So if you've already had that relationship, then that's beneficial. So that leads me to the post-operative Facebook page. That is not a substitute for a psychologist. It's not a substitute for the dietitian. It's not a substitute for seeing the doctor. It's not a substitute for calling and asking questions for what's going on with us. 95% of people that have weight loss surgery have a fairly similar experience. That first week is horrible. We feel bad. We're still recovering from anesthesia. We have post-operative pain. We have nausea. We're sick of liquids, but we're still on liquids. You know, we've already done that stupid pre-op diet that we all hate, and now here we're having to do liquids for another week, and everyone says, well, at least at the end of this week I get to have full liquids, but that's not everybody. Not everybody progresses at the same rate. Some people have to stay on liquids longer than other people. Some people are able to progress rapidly. Some people progress slowly. Some people do not have a smooth postoperative course. Some people have a very choppy, rocky postoperative course. So the post-op Facebook page, we purposely try to keep the information there positive. We're not doing that to make ourselves look good. We're not trying to say that everyone we do surgery on has a 100% perfect outcome 100% of the time. We're trying to keep it positive so people can be encouraged to see that there is light at the end of the tunnel, that there is going to be a better day down the road, and that we will get through this eventually. What our postoperative Facebook page is not is for us to vent our spleen. If you need to vent your spleen, if you're unhappy, if you're having a terrible experience, if you're having complications, I want you to see me, or Dr. Novak, or Dr. Roberts, or Dr. Snow. If you think that you're not doing what you're supposed to, or you're not progressing in the way that you're supposed to, or you're having problems post-op, that's mano y mano. That is for us. Because the Facebook group are not doctors, they're not nurses, they're not clinicians. I mean, some of them may be, but that is not a substitute for real medical care and medical advice. It's also not a substitute for, I'm mad at Sally in the office, or I'm mad at this person, or this person hurt my feelings, or this person isn't listening to me, or this. If you feel like that's happening to you, you need to call our highly overpaid, underqualified office manager named Matt. Okay, so you call up the office and say, I want to talk to the guy that's overpaid and underqualified that runs this practice, because I need to talk to you about something. And I hope he's listening, and I'm just joking. But that's what that's for. So I'm not giving you a lecture. I'm not trying to browbeat anybody. But I've seen this in politics. I have dear friends that live in different parts of the country that I see them saying things on Facebook they would never say to someone's face. They'd say hateful, mean, ugly things that frankly hurt my feelings or hurt other people's feelings. And we have been seeing that on our Facebook page. And in some cases, we have blocked people from the Facebook page. And if you're someone that's been blocked from the Facebook page, that is not that we're picking on you or mean to you or we hate you or something like that. It just means that we are really trying our dead level best to make that one little safe space for the early postoperative patient, or a fun space for people to brag about their success. So is it biased, and do we purposely try to keep it in the most positive light? You betcha. And it's under the thing is, if you have something positive to say, you put it on that page. If you have something negative to say, tell me. Because you know what? I don't want to be the emperor who thinks he has new clothes. If I've got a problem in my office, and if I'm being a jerk or something, you know, we all have bad days. Shoot, my wife thinks I could piss off the Pope on the wrong day, you know, to be perfectly honest, and I hate to use coarse language there. But we all have bad days, and we can all have personality conflicts with each other. That's why there's 4 different surgeons here in this practice. And boy, are we all different. And if you've met all 4 of us, you know we're all different. Surely one of the 4 of us can help you feel comfortable. So if you're mad at me, maybe you need to see Dr. Roberts for a week or 2, or Dr. Snow. And if you're mad at Novak because he's from Jersey and he, you know, talks like a Jersey boy, maybe you need to talk to Bubba a little bit here, with a little country accent for a while. So we're here to help you. And if you don't feel like you're getting the help you need, you reach out to me and you reach out to our office manager, but let's please try to keep our post-operative Facebook page encouraging and positive. So, you know, these things are hurtful and they stay around, and we have feelings, you know, so I'm a human being just like everybody else, and when I see a lot of vitriol in there, it causes other people to leave the page and not get that positive affirmation that we're trying to put out there for that. And to remind you that if you need one-on-one support, we got that covered. We contract with SciMed plus other behavioral health specialists here in the community. We'll hook you up one-on-one. We'll hook you up with a group. You know, our support group that was meeting every Tuesday night right here in this room because of COVID still can't meet, but they meet on Zoom every Tuesday night. We provide that. We pay for that. We contract for that service to be provided because we want you to have the support you need, and that helps you succeed. So I'm not preaching at anyone. I'm not yelling at anyone. I'm not singling anyone out. But if you're struggling, that's a clinical thing. People have complications. You know, not everyone runs straightforward. You can have a stricture in your sleeve. You can have a stricture after your bypass. You can have a slip after your band. You can develop all sorts of things post-operatively that we will eventually sort through. They're not always straightforward. Some people take forever to get to where they can eat real food, even when there's not a single solitary darn thing wrong with them. That doesn't make anything bad. That doesn't make you bad. That doesn't make us bad. That just means you're progressing at a different rate. So, clinical follow-up is critical. And if I have to see you every day for 30 days, I'll see you every day for 30 days. We'll get through this together. But let's please try to be kind to each other, especially on the post-operative Facebook page. And let's be kind to each other on our other Facebook page. And I'm the worst person in the whole world. I like to poke people with a stick, and I'm doing my best to quit doing that right now. I just pick on some of my oldest, dearest friends now, especially my friend Judy from high school, who I poke at like every chance I get. But please be kind. Let's get through this week. Let's get through this election. Let's get through this surgery. Let's get through this pandemic. Let's all take a minute and be kinder to each other. And we'll respect you. We love you. We care for you. We want you to do well. If you need us, we're here. We're here 5 days a week, every week. We never close the office except for Thanksgiving and Christmas and New Year. So I know I rambled a little bit, but my theme, if you get nothing else out of this week, is remember that we're all humans. We all have bad days. In fact, we were making a joke about the different doctors here, and we were giving ourselves dwarf names last week. We think Dr. Roberts is Dr. Sweetie. We think Dr. Novak is Dr. Dreamy. And so they decided my dwarf name was Dr. Grumpy. So I get that way sometimes, and I apologize in advance. So remember, we're humans. We have bad days. We're capable of failure. We're capable of being snarky sometimes, or a little bit short or a little bit curt. And I apologize when I've done that because I know I'm guilty of it. But let's be kind to each other on Facebook. Let's reach out and help each other. And let's get through this holiday season. Let's get through this pandemic. And let's emerge on the other side with a brighter future, a healthier future, so we can all move forward, get that weight off, keep that weight off, support and love each other, and move forward. And that's all I have to say today. Thanks. Thanks for listening, everybody.